So there are very sinister agendas behind all of this as well that can be possibilities as to
Absolutely.
why people receive bad therapy.
Welcome to the Critical Therapy Antidote podcast.
Welcome, everyone. Welcome to the CTA podcast. I know it's been a while. We took a bit of a hiatus due to a few developments at the CTA and also a few collaborations with other organizations. And I'm sure in time we will share some of these developments with you. We're also happy to have with us Michael Olin. Michael is not a guest. He is going to be a more permanent feature of the Critical Therapy Antidote podcast. Fresh out of college, PhD in clinical psychology. Michael, you're more than welcome to introduce yourself.
Yes, I'm Michael Olin. I'm a clinical psychologist. Just finished up actually my PsyD in psychology.
Gotcha.
And
Thank you.
I'm so happy to be here with you guys. This conversation is weeks and months in the making, but in reality, this has kind of been years in the making. As we've all spoken and kind of coordinated as I've gone through my student journey back out here into the real world. And I'm really just excited here because of what we're going to talk about today. Taking this opportunity to discuss Bad Therapy, Why the Kids Aren't Growing Up by Abigail Shrier.
Yeah.
Seldom do we get an opportunity. I mean, in the field, we have so much time to critique one another and critique what we think is going on. But very rarely do we ever take the time to contemplate how the world's perceiving us, how maybe people who aren't part of the mental health community proper, if you will, are viewing us and are taking in our activities and what kind of impact we're having as a mental health culture unfolds.
Valuable. Yes. So, and just for some background, so we got to know Michael from your membership with the CTA and also participating in our monthly CTA meetings, as well as our supervision and peer consultation groups. And we hope our viewers and our listeners will also enjoy your pieces of wisdom that you will share with them as well, because we always enjoy your contribution at those meetings.
Thank you so much. Hopefully it shows up today.
No doubt. Sure will.
Christine,
Yes.
Old
Yes.
Faithful.
Yes. Old Faithful.
Good to have you. It's good to have you back.
You too. It's good to be back together. I'm very excited. I'm also very excited because we are talking about this book in particular by Abigail Shrier, which Michael just mentioned, called Bad Therapy, Why Kids Aren't Growing Up. I think it's so timely and it's so necessary. And the book has gotten a lot of flack from a lot of different sources and people. So doing a little bit of a deep dive into what we see and what we're reading about, like you said, Michael, what the outside world thinks about therapists, because Abigail is clearly an outsider in the general population. And, I think clarifying a few things so that people have a better understanding of what it is that we see our role to be as clinicians is going to be just as important. So this is very exciting.
So we're going to deviate a bit from our typical episodes. In the past, we used to have a guest and we used to interview them and discuss things together. I think for the next few episodes, we will be discussing this book. And, for those who are watching, this is the book by Abigail Shrier, Bad Therapy, Why the Kids Aren't Growing Up. And like you said, it's an outsider's perspective. She's very well informed. She did a lot of research. She also, remember, a previous volume was irreversible damage, referring to the medicalization of gender confused kids and the absolute havoc and ravage, the absolute damage that medical and psychiatric practitioners have been inflicting on children that just needed support to grow up. So she has been in this vein of commentary, and I think this is very valuable. And maybe just to mention, when she describes what is going on in bad therapy, she's not describing what therapy ought to be. In other words, she's not describing therapy as it was originally intended to be. it is very much a deviation of what the idea of therapy used to be in our current culture. And I think that is also worth pointing out, and we will also comment on that.
Yeah,
So,
absolutely. Go ahead.
Yeah, so how about we start with a summary of the introduction and maybe the first chapter?
Sure. Okay, so the introduction, she starts off by talking about, she has children of her own, so she's very open with what her experience has been raising children, raising her child in particular, and what that's been like for her. So she starts off with just, an anecdote, a story that she experienced with her child. I think it was probably the first run-in she had with a therapist, and I think her child at the time was maybe 8-ish, around that age, coming back from summer camp. And her child has some kind of stomach issue or isn't feeling well. She ends up taking the child to see a doctor. And she's shocked to find out that she's asked by the doctor, by one of the doctors, to step outside while they ask her child a few questions about their mental state. And that's where it sort of all begins for her, I think, where it's confusing. Why are you asking these questions? It's also a little bit off-putting, and it might be even a little bit scary. She talks about kind of the anxiety as a parent of what's running through your mind when you have some other adult speaking to your child. You're not there. You don't know how they're going to answer the questions. And I think that's really important because fear and kind of the terror that's been instilled in parents in general over this entire kind of period that we're looking at is very key, right, to why the kids are in therapy, overly therapized to begin with. So that's kind of where we start with her, is just looking at, how did she personally come to this place of writing this book? Okay. And that's sort of where she starts. And then she gets into, chapter 1, which is about healers being able to actually harm. And that's something that we don't hear very much. The term, I'm going to butcher it, iatrogenesis. It's the idea that a healer can actually do more harm than good. There are times when healing approaches to anything from mental health to physical health can be more harmful than they can be healing. So she jumps right into that immediately after her introduction, and starts giving us some, context around where she came up with these ideas. And here she starts talking actually about, interestingly, her own therapy process and when she first went to therapy for the first time. And I think that's important also because it sort of colors and gives a little bit of shading to not only what she experiences as a parent, but also as a patient, as a client. So there's a lot of color there that she adds, some really interesting stories about, her first therapist and her first therapist's opinion about whether or not she should get married, some things like that. And we go from there. So let's just kind of, I guess, go back here we can to the intro and kind of look a little bit further at what she's talking about. The introduction is literally titled, "We Just Wanted Happy Kids." So in that sense, right, we know that she's already starting from a place of, hey, most parents are just trying to do the best they can. Most parents are well-intended. And I think that's a good place to start.
Yes. Yeah. And also parenting styles are oftentimes a product of the dominant culture. If the dominant culture prescribes to parent that this is good parenting, it is understandable that parents will start parenting in that way. And I mean, she admitted as much. The very kind and soft approach she had with her own children. But she reflects on that and says that, and demonstrates that she also used what we would call therapeutic language. That is because therapeutic language is everywhere. We hear therapeutic language on the radio. It really siphoned into our dominant, our daily discourse. Therapeutic language, even in education. And she asks a few, she asks a few good questions. She says, for instance, how did the first generation to raise kids without spanking produced the first generation to declare they never wanted kids of their own?
Mm.
How did kids raised to gently come to believe that they had experienced debilitating, how did kids raised so gently come to believe that they had experienced debilitating childhood trauma? How did kids who received far more psychotherapy than any previous generation plunge into a bottomless well of despair?
Mm.
These are good questions. The expectation is that kids with an easy childhood should be happier, should be more content and appreciative of what they have. We find the exact opposite in
Yes.
the emerging generation.
And this is where she first introduces the idea of trauma, is right here in the introduction. And that is key, because one of the biggest things that we're facing with schools, with children in therapy, is that they're inserting right into the schools and into, social emotional learning kind of models that everybody has been traumatized. So you need to sit and think and look for and identify your trauma. That's where you have to start. Right. So she is already kind of getting right into that in the beginning, which is really key for the rest of the book and the rest of the and the topic as a whole. Michael, did you want to jump in?
Yes, absolutely. And I think part of what she speaks to, at least in the introduction, is almost this abdication of the role of what a parent is, due to this fear that if you are maybe not as, and going back to what you were saying, Jaco, just the cultural mediated norms for parents, if you were to step out of that mainstream in some way, that you might be, misperceived or labeled as some sort of neglectful or harmful parent.
Yeah.
And that's an absolute looming shadow that she kind of paints for us there. The experience of being a parent in a milieu like that, where a medical practitioner can say to you when your 8-year-old comes in with a stomach ache, hey, I'm going to need you to step outside while I ask these questions that you're not aware of. And that can be a really scary, that's a scary proposition.
Well, there used to be this idea that, if you ask questions about whether or not you're thinking of harming yourself, those are some of the questions that this particular doctor was asking. In the past few weeks, have you wished you were dead? In the past few weeks, have you felt your family would be better off without you if you were dead? In the past week, have you thought about killing yourself? And so on. And there used to be a school of thought that asking somebody those questions doesn't put the idea in their head if it's not already there, right? And so there's that idea, but we also see that now more and more children, adolescents see suicide and self-harm as an option, and an option that they may not have had. When we were growing up, if we're going to just think about our own lives and our own ages, I'm in my mid 40s now. When we were growing up, that wasn't an option necessarily, right? There were a lot of things we thought about in when we were hurt and feeling that we needed release, but self-harm and suicidal ideation wasn't a part of that picture. So I think that there's some backpedaling now a little bit, that maybe we are giving that an option if we're asking the question at the wrong time, or maybe inappropriately, or maybe to somebody who doesn't necessarily need the question to be asked.
Well, if adults have those expectations,
yes,
that conveys the possibility to the child of feeling a certain way.
Yes.
So asking a child these questions could inadvertently plant in their minds a way that they could be. And that is the problem. And that is where she introduces the idea of iatrogenesis, where we need to be mindful of the possibility that our interventions could potentially contribute to the problem, or could potentially make the problem worse. But still, on the introduction, she also introduces the idea of diagnosis, and how this emerging generation includes psychiatric diagnosis as part of their identity. They describe themselves as, as who they are, a name, what they're interested in. And then also they would add what diagnoses they have. And this is unheard of. It's never happened in the past. Yeah.
And it truly is a moving away from a narrative in which we said we ought to destigmatize, certain pathologies, certain diagnoses, moving into the realm of almost this typification, this expectation that one would hold a label like this as in such a way that it almost becomes um, well, almost aberrant not to, in some
Mm-hmm.
sense. And
Right.
that, and as I was reading it, I was reflecting and just thinking back about just adolescent development generally, as your peer groups, as your, external network becomes so salient in your life. And if, and you start to kind of differentiate yourself from your family a little bit, having these ideas around you that this is the way to fit in really opens up that door for, if you're coming in to see a medical professional, and perhaps even with the expectation that something might be wrong, or with the desire to find something to be wrong, the odds that you will probably go up here.
Absolutely.
Mm-hmm.
Don't you guys also think that the idea that a mental health expert knows better than my parents also introduces the doubt, also it almost inflicts a debilitating wound in the confidence of a child's parents to raise them
Absolutely.
appropriately.
Mm-hmm.
So
Absolutely.
there is this degradation of the belief and the trust and the confidence in your home environment, the in the parental capsule that you find yourself
Mm-hmm.
as the appropriate place for you to be.
Mm-hmm.
Mm-hmm. Mm-hmm.
And a huge part of, and I don't know how much she's going to discuss this maybe later, but a huge part of child and adolescent therapy is working with the parents, right? It's working with the family, it's working with the guardians, because most of the time, if not 99% of the time, that's where the issues actually began, right? They began in some kind of split, some conflict, something that has caused this child to act out that usually, okay, stems from something that has been going on with the adults in their lives, most likely. So, this 1 hour per week that you're sending your child off to a therapist, not only does that in some way, uh, kind of demean the role of the parent, but if the parent isn't actively involved in
Mm-hmm.
whatever it is that's going on, then the parent does continue to take a further and further backseat away and become less engaged over time.
Mm-hmm.
It
Yeah,
just becomes a weekly appointment, and that's all that happens.
yeah.
Right. And so it's not to sit here and bash parents or anything like that, because again, we're making an assumption that these are all well-intended parents. That's what we're assuming.
No, absolutely. Absolutely. I think the majority of them are.
Yeah, absolutely.
And I
So
think what you're speaking to, though, Christine,
yeah,
is if there isn't that inclusion of the parents in the process, that what we're doing is we're siloing off a child from their caregivers. We're creating a new consensus reality where therapeutic language might be utilized in a way
yes.
that parents aren't privy to. And then suddenly they, once a week they send their kid off hoping that they're having any relevant challenges addressed, but then they're coming back and maybe if the parent's not being included, are getting this interaction that's completely and wholly divorced from what they're used to, the norms within the household or within the family system.
Yes.
Yeah,
Yes.
And at
yeah.
that point, we've completely diverged from what would be practical or helpful for an adolescent, or
Yes.
in this case.
We started to injure the attachment between the parent and the
Absolutely.
child. There becomes significant injury in that process, right?
Absolutely.
So,
Yeah, yeah.
um, so
And also, and
yeah,
also,
go ahead.
also, parents might lose confidence in the way they parent.
Mm-hmm.
Oh, sure.
And
Sure.
look, I've seen it, especially with this proliferation of gender dysphoria among kids. When
Mm-hmm.
parents bring their children, they tell us, "You're the expert. We can just repeat what you tell us to repeat." I mean,
Mm-hmm.
that is such an abdication of parental roles. That is such a surrender to a system
Mm-hmm.
that in many decades past has proven to be as uh, as having a proclivity for fads like the current fad.
Yes.
See, it is so risky to just surrender your parenting styles to what the system dictates.
Mm-hmm. Mm-hmm.
And
And
these fads are very We're not talking about fads like when we were growing up, punk rock was like a big fad, and shopping at thrift stores and being, going to, protests and things. We're talking about fads that are involving medicalization, I mean, medical procedures, right?
Yeah.
That are, I mean, they're irreversible. I mean, they can be reversed, but we know that if a child goes through the gender reassignment surgery process, and this is just a fad, they'll grow out of it. You're going to have undoing that surgical process leads to a lot more physical dysfunction,
Yeah.
lack of proper working of your genitals. I'm not an
Yeah.
expert on all of these components, so I won't speak too
Yeah.
much about that. But um, this is why it bothers me when people talk about this being a fad among kids, that this is a trend and it's a fad that's going to die down. Because in the midst of this fad, a lot of damage can be done that isn't going to be reversible. That's, I think, what's very scary. And I think, Michael, you were going to say something and I cut you off.
no, but I think what makes this difficult is that, and going back to the issue of identification here, is that if you start to see yourself as being, uh, your label, your group being paramount in how you view yourself, in some sense, I could imagine an individual coming in with that label, with that consideration about themselves, with maybe not a conscious recognition that they're wanting to fit in that way, but just this desire, this draw to fit in that way. And a a rise in anxiety to even explore the alternatives or the possibilities around that label not being so fixed within the
Yes.
individual themselves, not being the core component of who they are. And in that way, it makes it really hard to engage in whatever form of treatment, and I put that in
Mm-hmm.
air quotes in my mind, in any form of intervention that allows them to explore openly and honestly without the possibility of maybe rupturing something that is really of concern, perhaps their
Sure.
social lives, perhaps their sense of,
Sure.
and things that overall keep them feeling content and regulated, while at the same time perhaps overly preoccupied and concerned at another level.
Yeah. So I have noticed that when some of these youngsters identify themselves and tell you that they have a tendency to be depressed, or
Mm.
they're anxious, or they would come with all kinds of diagnoses. And sometimes it's like this list of achievements. I have tic disorder. I have
Yes.
low level autism. I am also prone to dissociation. I'm very anxious. It is the strangest self introduction, but it is almost as if they imagine these diagnoses to be a permanent fixture or a permanent feature of their personality. It's almost
Mm-hmm.
as if they don't see it as something that is possibly fleeting,
Mm.
that they
Mhm.
could overcome and live without one day.
And
Mhm.
that's actually one of the newest, studies that have come out, is that adolescent suicide, right? Completed suicides or even attempted suicide, a majority of the time, over 90%, 95%, are over changeable circumstances, things
Yes.
that will eventually pass and circumstances that will eventually change. So that's huge, right?
Mhm.
That what you're saying, Jaco, is so, compelling, because it is over things that are going to be, that are fleeting, but in the
Yes.
moment don't feel that way.
Yeah. Yeah.
Mm.
I like this one paragraph where she says, any intervention potent enough to cure is also powerful enough to hurt. Therapy is no
Yes.
benign folk remedy. It can provide relief. It can also deliver unintended harm, and does so in up to 20% of patients.
Mm.
Mhm.
Yeah.
Now I'm
So this
interested
idea,
in that
yeah.
20% though. I'd be interested to know where
Mm,
that came from. I'm just kind
mm,
of curious about that, how
mm.
that's measured, but maybe that's for another day.
Yeah. Yeah.
But maybe in line with that, when we think about things like iatrogenesis, so typically someone might hear that term in terms of medically induced harm.
Mm-hmm.
when we have an individual coming in who already has this preconception that something is wrong with them, and they announce it to their therapist, they announce it to their caregiver, their medical expert, the chances that they're going to find something that's going to be wrong, to the degree that we are reliant on something like self-report and somebody's personal experience to inform how we're helping them and what directions we're going to take next, it makes sense that with this rise in this cultural norm of coming in and having this expectation that there is already something wrong, that somebody becomes very susceptible and perhaps quite vulnerable to the next steps of the authority figure. In this case, we're talking about therapy. We're talking about the therapist, and what they decide is kind of the next reasonable step to take in the process. And at that point, goals and who actually holds what goal can become deeply misaligned or entangled, depending on maybe the level of awareness of the therapist or even the awareness of the client, or both.
It's very, very risky.
Very risky.
Lucas Klein once said that, when you go for therapy, you are going to someone who has the potential to brainwash you. And he's correct.
Yeah.
He's very correct.
Well, it's, I think we were talking about this before we hit the record button, about, this idea of staying with your feelings. It's something she starts to address in that first chapter after the introduction. And the fact that therapy really encourages you to do that, staying with your feelings, staying with all of that pain and all of those things that come up when you're in that space. And we were discussing how sometimes the most therapeutic intervention is actually distraction. It's not always about staying in the feelings or staying steeped in them for long periods of time. That may not be the most healing experience for somebody. That might be more harmful. And I think it's interesting because I worked with addiction a lot in my past career, in my past life. And there's something really powerful for addicts who are kind of in recovery and going through, urges to use. They have all these tools in their toolbox. One of the biggest tools they have is actually distraction.
Right.
It's stepping outside of that space in that moment and being able to focus on something else. It's one of the most accessible. I mean, you can distract yourself with music. I mean, you can distract yourself with a lot of things, cooking, baking, whatever the case may be. But the idea is that you step outside of yourself and you step outside of that kind of prison, that prison cell you're in when it comes to addiction, and you distract yourself with something else, eventually it passes. And so when I was looking at this and thinking about the harms, and the healings and the harmful effects of therapy, the harmful part for me that really stood out was this idea that everybody needs to be constantly thinking about their feelings or feeling their feelings all the time. It's what sparked in me the work that I did, and how for a lot of people that wasn't the best place to be all the time. That wasn't maybe in a contained place at a certain time, but it was almost drawing out, this idea that let's continue to keep you there in that space so that you learn how to tolerate distressing feelings, right? When sometimes you just need to not feel them and you need to distract. That's my personal clinical opinion, I suppose.
But I think
I wonder. Sorry.
Go ahead, Michael. Go ahead.
Well, what's so interesting about that is in the book, as she's describing it, she's also describing this culture that's taken place within the schools, in which there are these prominent, frequent check-ins of students' emotional states, and bringing these emotional states up to the surface of awareness, and then it almost feels like, at least the way that's depicted, almost just leaving it there. And at the same time, so we're teaching kids how to increase this awareness of their emotional experience. And at the same time, she brings up this issue of kids no longer taking risks in their own lives to live their lives, actually having this almost, I don't want to refer to as phobic, but almost this anxious reaction to the world and the possibilities around them. And that kind of left me with this question as I was reading was, what are our intentions, or what are teachers' intentions when we are engaging in these strategies? Is it that we're going off of some sort of rhetorical expectation that to feel your feelings is the point of gaining further mental health and mental clarity? And should we just leave it there, bobbing at the surface? I think I've spoken to you guys about this. It
Yeah.
brings to mind to me this idea of leaving a lure at the surface for any thought, whether it was prevalent before bringing up the emotions at all, can just rise up to the surface and grab on and become the associated experience for someone. Where anything that comes up, it's like, well, I recognized I was feeling this negative emotion. Perhaps it's related to this now. And I got the sense that there wasn't a lot of foresight or a lot of planning that takes place in these emotional check-ins, that it really is this strategy of, we're just going to bring your emotions to the surface and let things play out as they will. And I
It's
wonder if you guys kind of had
criminal.
that sense as well.
Yes, and I think it's criminal to do that in the schools. That's part of the
especially
social
children.
emotional
Mhm.
learning, right? Especially children. It's the social emotional learning. You have these unequipped teachers that are put in these positions that they shouldn't be put in either, with toolkits that they get from the internet, and that is over here where I live, one of the school districts out here actually uses a mental health toolkit that you download from the internet. And it's
Mhm.
got a series of, questions for the teacher to ask and interventions. So you're absolutely right. What is the intention here? And do these teachers even want to be responsible for this? Nobody's actually even thinking about the position they're in when it comes to that. So what is the intention? That's a good question. I think it can be sinister. I mean, I'm not sure where the positive intention part is. I mean, I'm sure there must be one, but I think I have such a personal, affliction against this that it feels extremely um, dark and sinister to me to have a room full of children in class in school that are all sitting there talking about their deepest, darkest, feelings and fears, and unequipped people, adults in the room to actually handle and manage those conversations.
And perhaps that social pressure to find something, even when
Absolutely.
at present it's not available to you. And
Absolutely.
there's a coaching taking place there, it seems,
Yes.
of dig down deep and join the group in whatever
Yes.
experience is most prominent in the moment, and do
Yes.
that
Yeah.
consistently over time.
So
Yeah.
the indoctrination, that's what I start to think of, is there's some sort of indoctrination
Indoctrination too.
quality.
Hmm.
Yes, a quality to it. So,
Hmm.
So Jonathan Shedler, a while ago, recently actually, tweeted this. He said, as a therapist, your job is not to push an agenda on patients, create converts to a worldview,
Hmm.
persuade, dissuade, approve, disapprove, affirm, or disaffirm. It's to help them know themselves more fully and so become more whole and live life more freely on their terms, not yours. In other words, psychotherapy is meant to expand the patient's sense of personal agency, not the therapist's.
mm,
Hmm.
So there's got to be a focus on strengths too. There's
hmm
got to be a focus on strengths. There's got to be an appreciation of defenses too, like you said, especially when you're dealing with someone with severe addiction or someone with severe personality pathology. And
yes,
it reminded me when you said, distraction would be one of the defenses encouraged by Narcotics Anonymous and Alcoholics Anonymous, etc. And I recall back in South Africa when we did DBT groups, we used to tell people, when you're emotionally dysregulated and you start noticing these changes in your body, see the warning signs and apply the 3 Ds: distract, delay response,
mm,
distance yourself.
hmm
Sometimes you need to go where the devil is not. That is what
hmm
Marie-Louise from France said. These are tricks to help you hold things together, to not make things worse than they already are, while you're starting or while you're figuring yourself out, while you're increasing your own agency in living life more freely. I think that
absolutely.
that was a valuable comment
Hmm.
by Jonathan Shetler. Yeah.
very valuable. And, it's interesting too, as we get into chapter 1, where this paragraph in particular, therapy can lead a client to understand herself as sick and rearrange her self-understanding around a diagnosis, and therefore encourage family estrangement. Coming to realize that it's all mom's fault and you never want to see her again. Therapy can exacerbate marital stress, compromise a patient's resilience, render a patient more traumatized, more depressed, and undermine her self-efficacy so she's less able to turn her life around. And I have personally witnessed this happen with some, greener therapists back when I was supervising, of wanting to actually change the way the client views themselves. They're actually, I guess, the brainwash was the word you used earlier, right? So there's a brainwashing quality to that, to where, gee, maybe it is all my mom's fault. And all of a sudden, all of these breaks and cracks in relationships start to show up, and they start to little by little disintegrate, right? And before you know it, this client has diagnosed themselves with every diagnosis under the sun. They now have broken relationships with parents, family, partners, etc. And that in and of itself has isolated the client and created an existence of life, which I think is harmful and has done more harm than good. And it's very easy to do that as a therapist, because we have a lot of power in the room. And that's just something that we have to know, because we have to be able to control it, manage it, in some way harness, the kind of power and authority that we have when we walk into a room with a client. It's there.
I think it speaks to that lens, and we were kind of speaking to this earlier, of when somebody comes in the room, if you yourself as the therapist are primed to look for dysfunction just by the nature of what it is you perceive you do, which is to, in theory, heal, help address, alleviate distress. And you can't readily find that in the individual, and they're coming in with a relational narrative. They're talking about, maybe they're a teenager, par for the course with teenagers having difficulty with their parents.
Sure.
With that lens in mind, anything that might be something that we would see as commonplace between, a parent and their child, we might start to see as highly dysfunctional. And inadvertently, in that maybe countertransferential reaction, begin to move the client down a path of separating, of moving away from, highlighting the negative as though that's the pathology that is under inquiry, that needs to be under scrutiny. And that's a very dangerous place for a therapist to find themselves.
Absolutely.
So it's clear that therapy can harm. I mean, Wilfred Beyond said, and in his many writings, he made us acutely aware that a therapeutic space, isn't by default therapeutic. There's got to be, you've got to employ your theory, your understanding of the psyche. You have to straddle both worlds, the internal world, but also the demands of the external world. And the aim is to get the person better orientated towards the external world with their internal world in mind. Yes. But you cannot just assume that the therapeutic space is some magical arena where healing just happens. It doesn't work like that.
Right.
It doesn't work like that. And I think the next chapter, A Crisis in the Era of Therapy, maybe we can move on to that chapter if you're okay with that.
Yes,
sure.
Yeah.
The next chapter highlights the potential for an agenda in psychology and in psychotherapy. So, Michael, how about you? You summarize that chapter for us.
Yes, I mean, she really opens up with the notion of the treatment prevalence paradox that, post World War II, we started to see an increase of, and I think she was particularly speaking to the United States in this regard, of mental health services. And what we would expect to see over time, and what she puts forth, is that we would also see, if we were increasing preventative services, if we were getting people in care before there was a need for psychological intervention, that in some sense we might step in like a dentist, getting in there and doing a mental health scrubbing before anything could, turn into tooth decay. But ironically, what we've seen over time is actually an increase in symptoms, diagnoses that we would expect to be improving, things like depression, anxiety. And in that, it starts to open up this question, which I think is kind of her main thesis of the book here is, you know, we saw this quadrupling and a second quadrupling is what she refers to over time at different time spans of mental health practitioners and available services. And yet, over time, we've just seen that increase.
Yeah.
And a little bit, she starts to lay that foundation of, you know, yes, we could talk about whether it's the internet and the influence of the internet and social norms changing. And I think there's definitely a conversation to be had there. But she also lays out, is it part of our work in the way that we see the world and the influence that we've had on people in general that has them coming in and walking out feeling like they're worse off, unfortunately. And
So just this morning, I attended a CBD, what do you call it? CEU course.
CBT.
CBD, you know, there's a continuous professional development course. And part of this discussion was such that I made the comment, and I think I said it before. And I wonder if this isn't part of the problem. And I think Abigail, in the development of a thesis of this book, will make it clearer and clearer to us. And that is where the appreciation of life as tragic, life as essentially tragic, human existence as an existence of suffering and tragedy in the Roman Greek sense, has been changed to life as a social problem.
Yes.
It's a social problem, and if the problem is social, the problem ought to be solved. And if it's a social problem, there's got to be a social cause, and those are the culprits. And I think it's left the impression, especially among the emerging generation, that we're not supposed to suffer.
Yes.
If we suffer, there's something wrong with life.
Yes.
Whereas in reality, it is just the opposite. If you suffer, well, that reminds you that you're alive.
That you're living.
That you're living.
Abigail points that out very well in her book when she says we're trying to essentially, I'm summarizing, we're trying to rescue kids from their despair. We can't bear to see children in despair or having an experience that causes that. So we're trying to rescue them and protect them from it at all costs, rather than being able to, sit with it, allow them to experience it, and allow them to experience moving through it, and allow them to experience what resilience looks like. We just want to skip that part. And she does a nice job, I think, of laying that out. That idea that, life is tragic. She uses the word despair, and I think it's pretty much, the same idea.
And I think in line with that, if we are getting out ahead of any form of suffering, which is one of just the fundamental vicissitudes of life, one of just the parts of life that both helps us grow, it can have the potential to injure us. If we're getting out ahead of that, though, are we taking the life out of living? Are we taking the breath out of the experience of just being a human being?
Yes.
And trying to almost, place a Band-Aid before there's even a scratch. And I think that speaks to the safetyism that she kind of alludes to here, that perhaps in that we are having this almost conditioning response. And I'm not just speaking about therapists, but maybe a greater cultural trend here to really try and get ahead of an existential reality, a fundamental reality of being a human being.
Yes.
Understandably so. No, in particular in our line of work, we don't want to see anybody suffer or anybody hurt.
Sure.
But sometimes the difficulties in life are the medicine. They are the things that make us better.
Yes.
I think she does that quite well.
Yeah.
And life is not fair. There's this very basic, I think, idea that life is not fair. And while we're constantly trying to make it fair and for everybody, not everybody can win first place. And this is so problematic for children and adolescents that are going through school, that are not learning how to deal with failure. They're not learning how to deal with disappointment in themselves, guilt, sorrow, feelings of loss. We're trying to take that away from them, which is why the kids are not growing up. They're not learning how to become adults and to manage that you're going to fail. And there's going to be times where you're going to do something that you feel guilty for, and that guilt is warranted. Not all guilt is unwarranted, right?
Yeah.
And that there are ways in which to live life, dealing with those emotions. But we're trying to block that out so that the kids, everybody's getting first place. Everybody in the classroom is going to get, an A on the paper. We're going to remove gifted student programs from certain schools in the US, which is happening, so that we can make it equitable. That's where those problems start to show up. And we start to see the intersection of what's happening with education and academia and what's happening with the therapy world.
Mm-hmm. I think you're speaking to something came to mind that I hadn't thought of in a while, which is this idea of a praise paradox, that in overt expressions of praise, so the idea that everybody's getting the same award
Yes.
at the end of the day, regardless of the amount of motivation or output, that it actually has a paradoxical effect in that you start to kind of lose your edge for this thing, your hunger for this thing, their thirst for this thing, because now we're not really finding that motivation or desire to engage anymore from the inside.
Yes.
We're externalizing it out to, hey, maybe that's not fair. I know I did the most here, but everybody's getting the same result. Why would I keep trying to do this? Why would I keep trying to put forth
So
this effort?
dangerous.
And it really can be, in terms of self-efficacy, it can really throw the pursuit of self-efficacy out the window.
Absolutely.
Mm-hmm. Yeah. I couldn't help but be reminded by the fact that is one of the criticisms of communism.
Yes.
There's no motivation to improve because everybody's just getting the same reward.
Yes.
Anyway.
Yes.
So in our cultural milieu, in our cultural milieu, people grow up to believe that pain can only have one meaning, and that is that pain is harmful.
Yes.
Pain cannot be meaningful. Pain cannot give you a sense of achievement. No, it's pain and discomfort can only be harmful. Disagreement means one thing, and that is hate. Everybody needs to be fused. Everybody needs to be enmeshed, and everybody needs to agree, right? And criticism is an attack. And that is the very fragile, non-resilient, emerging generation that we're seeing around us. And by the way, and going back into political science again, there is no longer, there is a fading of the division between the private life and the public life. Because we would associate this level of comfort with the private life. But because they introduce all these policies to make life everywhere super comfortable, from safe spaces to trigger warnings to watching your microaggression, etc., we're almost invading public life with a private life ethic.
Yes.
And with that private life ethic also comes a lot of control. And that is problematic
in the
political perspective.
And I'm getting the sense that you're describing taking our comforts from outside of our home with us into the chaotic mess of the world in a hope that you might be able to apply it elsewhere. I think Shrier was describing this a little bit when she was interviewing folks who were running schools, and she was asking about the cell phones. Why are cell phones no longer being taken from children and being kept apart from them during the school day? And one of the responses she got was, well, it keeps them calm. And I wrote in my notes as I was reading pacifier ? It really that's what it felt like.
That's what it's like.
You've left this compulsion engine in somebody's lap or in their pocket, and that in order to make things less difficult, less challenging for yourself, because you're trying to keep everybody regulated throughout the day, you've also given them something that's deeply distracting and something that's intrusive on their thought process while they're in a setting that theoretically they're supposed to be learning in. And I found that so just humorous in a dark way, because I'm just like thinking about handing out pacifiers in the room. That's what kind of came to mind. I was like, that doesn't seem helpful at all.
So fragile.
And so bringing that comfort with you.
Yes. And social media is known to have a direct correlation with increases in depression and anxiety among youth. So you have them focused on that. I've mentioned this before that I worked at a care center where students would be able to drop in and just hang out if they were having a hard time in class or a hard day. Well, what happened with all that is that we would have the lines wrapped around the school of kids wanting to, they have a math test, for example. So they're coming to the care center distressed and depressed and upset. And at the end of the day, they're skipping math. The amount of students that use that service versus the amount of students that needed that service was extremely upside down. I would say 5 out of every 100 that came in, and I'm talking about a couple of hundred would come in. Okay, it was a really large school, and anyhow, probably needed it, but that's it. The rest were just screwing around, but it wasn't our place necessarily to say, you really need to be in class. You don't need to be here. You're just distracting, because no, we wanted it to be an equitable space for equal opportunity for anybody who wanted to do that, and we couldn't really question it, right? So that's, I mean, this was in 2018-19, so obviously this has been going on for many years now, long before that, but that's when, starting to see how these things, and some of the reasons the kids would come in, they would pull out the cell phone and show us, well, Billy just dumped me on Instagram in front of everybody. Now I'm depressed. And so access, right, to that phone, to the social media, and to this care center was a perfect storm for little Susie, who's upset at Billy for dumping her, to start telling us that she's suicidal. And this is what we would run into. It was a chronic issue. And the more we offered the space, the more we gave them an opportunity to leave class, the worse it got for us, right, and for them, for the students.
Right. And that's iatrogenesis.
Yes.
An intervention that was meant to help created greater problems. Yes.
Yes. Bingo.
And if the impotence for that intervention was to reduce one form of harm, when it became unquestionable, it became untethered from being able to identify what other forms of harm might follow in its wake. And that's
absolutely. The kids were vaping in the bathroom, and we couldn't say anything about it. We had a bathroom in that center, and the kids were starting to vape and go into the and we couldn't. So now we had a vaping problem on top of that, and we weren't able to invade space by going into the bathroom, but we knew what was happening. So it was the problems continued to overlay each other. Absolutely. So all of this, I think, is very relevant to what, Shrier's talking about. And I'm quite impressed with the fact that she's able to kind of pull all this together, having not been on the inside, quite frankly.
So she goes to the climate anxiety subtopic.
Yes.
And she's referring to this one researcher, Carla Vermeulen. She sounds very Afrikaans, Carla Vermeulen. I don't know what her background is. I looked her up, but
couldn't find anything.
She just looks like a cat lady. But anyway, so she talked to Carla Vermeulen, who wrote this book, Generation Disaster: Coming of Age Post 9/11, and she says, young people. She spoke to her, and she thought she was a kindred spirit, the researcher. And when I read this, I realized that psychology and psychotherapy can easily be harnessed to achieve a political outcome.
Yes.
For instance, when she asked her why she thought that this generation was suffering like this, seeing that this generation is by far the most privileged generation who have ever existed. Says young people are resilient and strong, she assured me. They are simply meeting more formidable challenges than any generation before them. They're dealing with all of these other stresses, but it's all floating on this unstable surface of climate change, she said. So you don't really get the impression that Carla Vermeulen wants to do much about building the resilience in these youngsters.
Yes.
You get the impression that she's saying that these youngsters have all the reason to be anxious.
Yes.
So you leave it like that because there is a climate crisis scene. And then there is this other place where she says, I asked Carla Vermeulen if it would ever be appropriate to say to a kid, listen, you're really exaggerating the threat of climate change right now. Let's get through the week. Vermeulen becomes visibly stricken. I would never tell someone they were exaggerating. That's very invalidating and not helpful. That's going to raise defenses and make them feel unheard. You
There's the problem.
see,
There is the problem.
when you have an agenda, you make use of what is available to you, you harness those anxieties, and you create fodder for the combat, even if that fodder were children.
Yes.
Yes. And there's that implicit
That's deplorable. I'm sorry. That's deplorable.
Mm-hmm.
Anyway.
And there's that
Very.
implicit inframing. I think you brought up the political agenda, the political component.
Yeah.
This inframing that the type of anxiety that we're seeing is somehow novel from anxiety as a category. That we now see this form of environmental anxiety, this climate change anxiety, and that it's predicated on some form of truth. And when I think about being a therapist, I don't think about trying to discern whether somebody's concern is some form of truth or something I agree with, or whether the belief has veracity or anything along those lines, but more in a sense of we have we have anxiety that has arisen here. We understand the function of anxiety. I need to understand and contextualize it in this individual's life. And the way that it's manifesting currently is that there's a focus on the climate, climate catastrophe, on how the environment is doing essentially. But I'm going to treat it as this novel, and legitimate threat, almost as though we're putting this. It's akin to putting the demon outside the front door and saying that it's an imminent threat for you. And I can assure you and I can reassure you that that's the case, because I too, and I'm not saying it, but through my actions, I might be implying I hold the same assumptions. I hold similar suppositions.
Yes.
And that's something that while understandably, if you want to assuage somebody's concerns, makes sense. But at the same time, are we really taking a moment to really understand when did those concerns start to show themselves in this particular way? Is this really different from the experience of anxiety? And I don't think I got the sense that, at least from the book, that this individual thought that was the case. No.
But these practitioners have really abdicated their responsibility, and that is not to indoctrinate your client. And we know, and this is the activist type. These are identity practitioners. These are the activist type therapists.
Yes.
Where they really want to bring their clients under a certain impression and understanding of the world. Whereas if you're neutral and I work from a psychoanalytic perspective, as you know, so you straddle two worlds. Regardless of what they're anxious about, we understand that is a transference acting out. It's a transference acting out. In other words, something internal to them. They scan the environment all the time, and they find whatever resonates with something internal to them, and that they enact upon the environment, and that is your focus. And with skill, the person eventually learns to resolve that anxiety.
Yes.
You see, but if you have an agenda and if you're an activist,
yes,
you cannot afford to resolve climate anxiety, because you need these people to fight the good fight.
Yes.
And we all know desperate people are easily exploitable. And easily exploitable people are easily controlled. They do what you want them to do. Yeah.
And if you give them a concern, if you continue to perpetuate a concern that is beyond their personal ability to really, in any sort of sensory way, identify it, engage with it, I get the sense of almost swinging at smoke. You've given somebody the boogeyman and beneath the bed, and no matter how many times you look to disconfirm that it's there, if we still have the conversation that it's looming and it's waiting for you to be anxious about, I'm not sure how that's productive care. I'm not sure that we're really giving somebody the insight and the ability to understand, again, when did this first start for you? Were you born being concerned about the climate, or did you have a tendency towards anxiety maybe,
Right.
and this has become a concern of yours recently?
Right.
And I'd love to understand what's of meaning here, what's of significance here. But if you keep it, as you said, Jaco, keeping it going kind of becomes this preeminent agenda.
Yeah.
If it keeps somebody coming back.
And the impression I'm getting is that there are two kinds of people who benefit from this. Those who want to be powerful and want to exploit the vulnerabilities of others, whether privately or politically. And secondly, those who want to become rich. And that is the conclusion of this chapter. There are perverse incentives for keeping children sick, because there are apps and there are services that just rake in the money because children are sick. Why would you want to cure children if their sickness means your fortune?
It's Shrier calls the sessions a dose, right? That's our medicine. It's a dose.
Yes.
The way in pharmaceutical, company, or with the pharmaceuticals, or with doctors, as she says, okay, maybe you're on a drug for a while, then you don't need to be on it. You stop, but you continue to be that person's patient. They still have you as a patient. You're still there for other things. Not with therapy. Once they've been, cured, if you will, under quotes, obviously, and you lose the patient, they don't, that's your stream of money. That's your stream of income that you just lost. That's the dose of medication.
And it's at that point where we've stepped into the world of what the therapist feels is of most paramount importance, whether they want to consciously acknowledge it or not. Is completely taking the reins of the therapeutic. I think she actually referred to it as the beachhead community, this young generation of Gen Zers who are coming up, continuously being able to market and to bring in, where the classic sensibility about the therapeutic process, at least in my view, has always been, in what way, technically, or maybe eventually, do I work my way out of this job? Do I help you to a point where you can live your life and not feel tethered to this space? Where can I help?
Dependent on you. Yeah, absolutely. Because that does keep the checks rolling in. And that's something that as therapists, we have to be checking ourselves. When a client's ready to go and ready to launch, what do we do about that?
Yes.
We have to help them.
Termination.
We have to help them get ready to leave. That's what we have to do. And working with the very green therapists is one of the hardest things for them to recognize. But I would say I have seen people in practice for 30 plus years who have just as difficult of a time in doing that. And then what's it about? Is it about the money? Is it about your own attachment to the client that you can't let go of and move forward from? What's going on here? But as you say too, Jaco, there are very sinister agendas behind all of this as well that can be possibilities as to why people receive bad therapy. Just go back to the title.
Yeah.
All right.
So will that wrap it?
Yeah, I think so.
Yeah. So next time we will discuss chapter 3, bad therapy, and chapter 4, social emotional meddling.
Yes.
I'm looking forward to that.
Yes, very exciting. Thank you,
everybody,
very much,
for
joining us. Yes, thank you.